So I'm super excited to share with you guys the complete shoulder pain reset guide for lifters, how and when to choose the right fast relief pain relief option in order to help jumpstart your recovery and help to find some immediate relief. So this is going to be a really powerful comparison chart to help you determine what to use, when, and why. If you are looking for a quick win to help you jumpstart your recovery process and to more effectively get into addressing the root issues or underlying causes of your chronic shoulder pain. So, we're going to go over when you would use things like over the counter medications versus prescription medications. Obviously, that's going to be directed by your physician, and you would need to have a prescription that was prescribed specifically for you. When are you going to use things like massage guns, or foam rollers versus using electrical stimulation or dry needling and acupuncture or things like ice and heat? So, when trying to determine which choice to use and what's most appropriate for you, this chart can be great to consult. So, for example, if you're dealing with mild inflammation or pain associated with swelling, maybe you've had a flare up on your chronic issue after re aggravating your shoulder again in the gym, using something like an ibuprofen or an Aleve may be an appropriate solution for you. Again, it depends on your individual health and how well you tolerate those things. Now, on the other hand, if you're having severe or acute pain that's not touched by some of those over the counter medications, or you're having nerve related pain or muscle spasming, there are some prescription medications such as muscle relaxers versus some of the Neurontin and pregabalin, things of that nature that can help out with some of those different types of symptoms. And again, if that is something that is prescribed to you by your physician, then in those specific cases, that might make the most sense to help you sleep throughout the course of the night and not have that severe pain start to impact other aspects of your life or your movement as well. Now, if you're dealing with a lower level of muscle tension or just overall soreness, being able to reach for a massage gun or a foam roller can help to reduce some of that pain associated with those types of symptoms. And if you are looking to avoid prescription medications, or you've taken prescription medications for a few days and you are still having pain, but you're looking to get off of opioids or some of those more addictive chemicals, then something like electrical stimulation or e-stim may be a good option for you. And we've got other videos in this series where we'll dive into deeper detail about which type of e-stim might make sense to use for which type of pain and in what area. But overall, it can potentially be an alternative to some of those other medications higher up on the list here. Now, things like dry needling or acupuncture, and dry needling in particular, can be used for tension and knots or trigger points throughout the muscle that can be causing pain in and of themselves, or could be pulling on and impacting the joints that those muscles and tendons cross over. And so that can be both a short-term pain relief option, as well as if it's paired well together with some corrective exercises underlying the root causes in terms of things like poor movement patterns, postures, or muscle imbalances that are contributing to your ongoing shoulder pain. It can be a good jump start to address those specific issues. And then lastly, ice or heat, not going to make a significant difference in the overall recovery process in the vast majority of cases. However, if it does provide you with some short-term pain relief and or distracts your brain and your body from the pain that you're experiencing, then you can certainly use either one. And I'll often tell people to kind of go with the one that gives them the most pain relief, regardless of kind of what traditional thoughts are surrounding ice or heat. So again, a quick summary of this chart. I think you guys are going to find it really, really valuable and can be a great reference to go back and check out if you are having a little bit more of an acute flare-up, or you're looking to get some short-term pain relief. Again, some of these you'll want to use sparingly and only under the guidance of a physician in the case of the prescription medications. with over-the-counter medications, make sure that you're obviously not allergic to any of these and that you're aware of some of the side effects of taking any of those medications on a regular basis. Um, so again, go ahead and consult this chart. It will be super helpful for helping you to find solutions and find quick wins for short-term pain relief, and hopefully helps you to buy into the longer-term solution and addressing the root issues that need to be corrected to overcome this issue for good.